Hello there, and welcome to my presentation on the barriers to accessing affordable housing in Portland, Oregon. I completed this research as part of my thesis project in architecture. I'm Max, and before I get started, I would like to thank a few people. I would like to thank Justin Fowler, who is my advisor, as well as the University of Oregon International Review Board for helping me set up in-person interviews and the procedures around that. I would also like to thank Street Roots, the street paper that put me into contact with a lot of the people that I ended up interviewing, as well as a bunch of other participating organizations that I interviewed, which will be listed on slide 4. Portland has been experiencing a housing crisis for a number of years, as I'm sure most people are aware, as well as Oregon, the West Coast, and most of the country. In 2022, this past year, over 5,000 people in Multnomah County itself were reported sleeping on the street or in shelters, and that is also most likely an undercount. Of that 5,000 people, around 3,000 were living unsheltered on the street, while about 1,400 were in shelter and a little over 600 were in transitional housing. That 5,000 people number is compared to the 2019 count when there were only 4,000 people living on the street. And a lot of that increase is due to the COVID-19 pandemic. However, it is also a consequence of the increased unaffordability of Portland and the low housing stock. In Portland right now, there is only around about a 4% vacancy rate, which means that almost all apartments are being used. Every 2 years, Portland and Multnomah County undertake what is called a point-in-time count, where they go about and do their best to survey every person who is living on the street over the course of one night. This year it took place in January. And one of the things that they found was that there was a very large increase in the percentage of people living on the street who were chronically homeless. And what that means is that they had been living unsheltered for over a year consistently, and they also had at least one disabling condition, whether that be a physical disability, a mental disability, or a addiction to drugs or other disabling conditions such as that. There are many factors that go into the total increase in the number of houseless people, especially the people living on the street. These include an increased number of people who are actually losing their housing, whether that is through eviction or other means, including it also includes a lot of barriers that are preventing people from becoming housed once they are houseless themselves. This presentation will mostly focus on that latter half, the people who are chronically homeless. So the experiences that they have had living on the street and trying to become housed, as well as the barriers that are preventing them from becoming housed. This presentation and this research really focuses on their experiences. And over the course of this presentation, I will go through the methods and techniques that I use to document their experiences through interviews, as well as the results, what I found, some of the commonalities between the different people that I talked to, as well as the takeaways from my research. Over the course of this research, I interviewed several groups of people, one of which was the professionals that are in charge of the housing affordability systems themselves. Some of these include design firms, such as architecture firms that are designing a lot of the affordable housing in Portland, the companies that manage transitional and supporting housing projects, such as Artist Future, Path Home Northwest, and Bud Clark Commons, as well as Home Forward. Home Forward is actually the housing agency of Portland, so they oversee basically all of the supportive housing in Portland and direct funds that they receive from the federal government. I also interviewed some supportive service providers, such as Blanchet House, which, as well as providing some affordable housing, also runs a soup kitchen. LifeWorks Northwest, which provides a lot of mental health and drug addiction services, and Portland Street Response, which is a new program that the city runs, similar to a first responder aid organization that aims to help people in crisis in a nonviolent way. I also interviewed 10 people who were experiencing housing instability. 5 of those people were living unsheltered on the streets, while another 5 were in some sort of supportive or subsidized housing in the city, some of them living with some of the organizations whose managers I interviewed as well. So that was really interesting to see. One of the really important things that I took into consideration while doing the interviews was the way that a lot of the interviews could have the possibility to expose a lot of the trauma that these people are experiencing, and trying to approach their experiences and their stories in a way where they felt comfortable and where they felt safe. For the people who were living on the street or had at some point lived on the street, I always started out with a very simple question, can you describe your day? And went into some more revealing questions later on about, well, what sort of things gave them anxiety or fear, what had their experiences being with different services, and whether their services had been as helpful and understanding as they needed them to be. It's also important to note that these were very much unstructured interviews, because a lot of the questions that I would need to ask to get some of the answers I don't know myself. So while these questions started a jumping off point, you could say, the interviews themselves, which often lasted longer than an hour, gave kind of a wide-ranging, they went in a lot of different directions. Over the course of the interviews, I found that there were certain commonalities between the experiences and perspectives that people who are housing insecure had. The first being that employment was really hard to find when living on the street for a variety of reasons. The second being that disability and mental health had a very large impact. The third being that shelters and services had a variety, a big range of success in terms of how helpful they were to the people who are using them, both between shelters and other services. The fourth was that there was a lot of violence that they were experiencing, not just from other individuals, but from organizations, including government organizations. And the fifth being that having someone who cared, a caseworker, someone who really dedicated their time to try and make their lives better and eventually house them, was super important in getting them housed and getting them into services and back into shelter. Some of the main reasons people expressed that they were having trouble finding employment included discrimination against housing status. Many people said that when they asked an employer for a job, if the employer found out that they were homeless, they would be automatically rejected. Other employers would ask for an address, and if they didn't have one, they would be declined. Other people that I interviewed expressed that they were not even looking for a job at the moment because living on the street itself was too much of a stress to handle the responsibility of going into work every day, and that simple things like being able to take a shower before work, being able to consistently make a daily schedule was really hard when living on the street and not having stable shelter. Mental health was another thing that affected most of the people that I talked to. a lot of them expressed that loneliness was a very hard thing to deal with, especially because the communities that they would form were not always stable. Oftentimes, a person was not able to be in the same area as another person, and they would lose contact. Sometimes phones would get stolen, or simply run out of batteries. And the general public, the housed population, is not often friendly to people living on the streets, and they face a lot of discrimination from housed people as well. A lot of them mentioned that the stress and loneliness that they experienced while living on the street made it easy for them to become addicted to drugs, which often had a detrimental effect on their mental health as well as their physical health. This graph here shows the deaths of individuals without a known address, most of whom are homeless, and the vast majority of those deaths are related to drug overdoses, as well as sizable amounts relating to homicide and suicide. One of the most common things people talked about was being discriminated against in shelters and other services, especially those with disabilities. A lot of them mentioned that the shelters that they tried to get into were not equipped to handle mental health needs, and that the people who ran the shelters would sooner throw them out onto the street than deal with any complex issues. This shows up in the broader data as well. According to the 2022 point-in-time count that was done, people in shelters were much less likely to be disabled, and especially much less likely to have a mental health condition or a drug, any sort of substance use disorder. And for people who had both a mental health disorder and a substance abuse disorder, they were even less likely to be found in shelters. The combination between having multiple disabilities and being more likely to be sleeping out in the elements is a big reason why there are so many deaths among people living on the street. One of the things that the people that I interviewed expressed the most was a desire for consistency in their lives, a consistency of shelters as well. For those not staying in shelters overnight, many of them sleep in doorways or in tents on the sidewalk, and they are subject to frequent sweeps that the city conducts nearly every day. This is a map just of 3 weeks of sweeps that were occurring between late October and early November. During the pandemic, the number of sweeps was greatly reduced. However, last March, there was a dramatic increase in sweeps. And a lot of the people that I talked to mentioned having their possessions taken away when they weren't there, and being unable to recover important possessions such as the laundry that they had, or sentimental items, or tools that they used to make a living. The number and type of sweeps also differ a lot based on the area of Portland in which they occur. Most of the people that I contacted and interviewed lived downtown, and downtown experiences sweeps primarily because of reports of unsafe conditions or large number of people in the same camp. However, it must be noted that the number of times a camp is swept does not necessarily deter it from coming back, because there is a limited number of places for a person to be in the city once they are removed from a certain place, which is always disruptive to their lives. The spot is often occupied within a week, and the cycle continues. Usually within a few weeks, this site is swept again. While the sweeps of campsites is a more persistent threat in the form of kind of chronic violence that people living on the streets face, there are also rarer but fairly common threats and abuse that they experience because they are more exposed on the street. The people living on the street only make up about 1% of Portland's population. However, they, over the years, have consistently accounted for at least 15% of the homicide victims in Portland. While a tent can provide some protection against the weather, it is a pretty flimsy defense, and oftentimes they get burned down, and there are many reports, at least of the people that I interviewed, of people avoiding certain areas, especially downtown, because they were afraid that they would get assaulted, especially at night, and that they would come down during the day to access services and go to a different area of town to sleep at night. Of the people I talked to, about half had either been homeless and then gotten housed, or had a place that they were imminently about to go live in to find some shelter. And among those individuals, all of them unanimously had a caseworker or someone to support them, to help them go through the system. Those that were already in homes credited the caseworker with a lot of that success. And a lot of the data from other studies bears that out as well. One study in Seattle, for example, found that though among recipients of Section 8 vouchers, which are rent subsidies given out by the federal government, those with a caseworker were much more likely to be able to use that voucher and to be able to use it in a neighborhood that had better opportunities for living and for future employment. While there are a large number of chronically homeless people living in Portland, the vast majority of the people who become homeless sometime throughout the year are only temporarily homeless. And because of this large number of turnover, one of the most important things to do is prevent people from losing their homes in the first place. Oftentimes people will get evicted because they are unable to pay the rent. That is by far the largest reason people get evicted and become homeless. And having rent subsidies and short-term rental assistance for those people can often tide people over in an emergency and drastically reduce the number of people who actually become homeless. For those who do become homeless, having housing can often address a lot of the other issues that they are struggling with, whether that be mental health problems or drug abuse, both of which are exacerbated by lack of shelter. And it is often, as I've shown through some of the other interviews I've done, much easier to get a job once you are actually housed and have basic resources such as a shower and a stable place to come home to at the end of the day. Caseworkers are also extremely essential for this, for guiding people through the system who might not be familiar with the complexities of Portland's housing program. And finally, protecting those who do not actually have shelter. Increasing the number of emergency and warming shelters, as well as public showers and toilets, is really important, and increasing our capacity for drug and mental health services is also essential to reducing houselessness. That concludes my presentation, and I would like to thank again the university for putting on the symposium, as well as everyone who watches this. Thanks.